Hello people, in this video let us look at the contents of crash cart very quickly. Okay, so some crash carts are like this with left and right. In this one we are talking about this type of crash cart where there are drawers. Okay, and here we are talking up to 4 drawers. So please look at this. So crash cart is a trolley which will store life-saving equipment and drugs. Okay, so basically you can easily move it and it will be readily be accessible, right? And you should be trained to know what is where to have a quick response. So let's look at one by one. On the top, so not the top drawer guys, on the top what will you keep? Okay, so you will keep some equipment like defibrillator, so to give electric shock to the heart, right, if somebody is in cardiac arrest. Stethoscope you will keep, obviously you know the use of stethoscope to check the heart sounds. Then adult and even respiratory sounds. Yeah, what is this adult? What did they write here? Maybe they mean ambu bag for adult pediatric or something like that. Then CPR board. So is that a CPR board? This they are showing this board and then you have to use it, but we did not use this board. I don't remember. ECG jelly, same as your ultrasound jelly, scissors to cut all those bandages, catheters, everything. You know that. Adult ambu bag with reservoir. So here they wrote adult. Why did they write adult here? Okay, face masks. So quickly you wear and you get to the field. Kidney tray to put any samples or if you want to collect something. Ampule cutter. Ampule cutter if you have good. Otherwise we used to just break with tissue paper and our hands. Oxygen cylinder key. So there should be a key for the oxygen cylinder on top itself. Okay. What about laryngoscopes? Where do you keep them? And what about tongue depressor, torch? That they didn't mention here. I would keep a torch also. Then some Locks jelly, that is lignocaine jelly, some plasters, some surgical blades they are saying also you can keep here. Okay, so that I think we should add. I would add torch to this. Otherwise laryngoscope and all we used to keep down only, I think, right? Tongue depressor also, it is kind of sterile lignocaine or xylocaine jelly. Okay, if you want you can keep here, that is your choice. Okay, moving on. Shall we move on, people? We are going to what? The top drawer now. You're going to open the drawer and that you will see a lot of medicines, drugs. So you will give adrenaline. You will give for allergy, anaphylaxis, alright, circulatory effects, urticaria. Now let's move on to midazolam. Why will you give midazolam, people? To calm the patient down mostly. Benzodiazepine. The buccal midazolam, right, that is a spray you can use as a anti-seizure medication. So that is very important for you to know. It's a benzodiazepine sedative actually. Why will you give noradrenaline to anybody? Norepinephrine. Basically for hypotension they are giving noradrenaline, okay, if there's hypotension. In fact the correct word is refractory hypotension, people. Don't write something wrong, okay? Refractory hypotension, noradrenaline, okay? Refractory means what? Stubborn or unmanageable hypotension. That's what they're saying. Magnesium sulfate. Why will you give magnesium sulfate? You already know one cause in obstetrics, right? Eclampsia. Torsades D points, right? Some, if it is there along associated with QT prolongation. So if you're seeing some ECG changes, that will require magnesium sulfate. That torsades D points. Some treatments itself will cause that. Okay. So ventricular tachycardia. So then you will give magnesium sulfate. So QT prolongation they are saying, okay. QT prolongation may culminate with torsades D points ventricular tachycardia, which is treated with magnesium sulfate. Okay, people. Now next one. Where are we? Here. Atropine. Why will you give atropine? Okay, tell fast. We will give atropine if there is OP poisoning and carbamate poisoning, but you should give it very early in OP poisoning. It is an antidote actually. It is going to be used to treat symptomatic bradycardia because it is an anticholinergic drug. So if there is symptomatic bradycardia, that is heart rate is slow. So to summarize, you can use for acute cholinergic syndrome, for AV block, for carbamate poisoning, right? Cardiotoxic drug poisoning, organophosphorus poisoning, sinus bradycardia. This is nothing but amiodarone. They have written some trade name here. We don't want that. Amiodarone, okay? Amiodarone you will give for what? To treat arrhythmia, right? Irregular heartbeat, fibrillation, for tachycardia, etc. Amiodarone. So you can give for arrhythmia, atrial fibrillation, atrial flutter, tachycardia, okay? And That is the use. Moving on now, calcium gluconate. Okay, we are here. Calcium gluconate you will give if there is some cardiotoxicity which is caused due to hyperkalemia or hypermagnesia. Okay, so basically you have to manage cardiac arrest. Okay, hypocalcemia, etc. So are we here in dextrose? Yeah. So dextrose you will give if there is hypoglycemia, right? If there is less glucose, you'll give dextrose. So just remember, sometimes you will also give dextrose with insulin in some cases, right? With insulin itself, you'll give dextrose. Not sure, but if it is emergency, but the patient can is having hypoglycemia, but if the patient can take orally, we can give them a chocolate or something, right? Now we are going on to the next section here, people. Okay, Loxicard. Why? What is this Loxicard that they have written? Her own very famous lignocaine hydrochloride injection. That's all. Oh my God. I think they should not put this name here. Okay. Anyways, Lasix. So this is local anesthetic. I won't cover that now. Lasix. Lasix. Well, you give diuretic. So basically, if somebody has a lot of edema, you can give this. Lasix is furosemide, people, or furosemide also some people say. See, this is a crash cart, so they will keep everything injection only. Furosemide is there here. Okay. What is it? Diuretic. So it will combat fluid overload, right? This is a diuretic. So you can give it for acute pulmonary edema. Then what else can you give it for? For heart failure, for hyperkalemia, so that you can remove all the potassium, right? For hypertension, so that fluid will become less, right? For all these reasons, you can give. Also, if you're giving so much of overload, no, of fluids, acute transfusion reaction if people have. Even if you have given blood which is ABO incompatible, sometimes you can give furosemide. Smile, people. Let's move on to the next one here. This slide will take time. Okay, everything else is direct. This one you need to know. F core line. What is F core line? F core line is nothing but hydrocortisone. So basically, it's a steroid. Why will you give it? Why will you give a steroid to somebody? Don't dance. Where are we? In this one, F Corlin. Please let's move a little this side. So why will you give steroid, people? F Corlin injection, ACTH deficiency, adrenal insufficiency, asthma you will give this. Remember, in anaphylaxis, emergency management. So that is what you have to say. Anaphylaxis, you have to give hydrocortisone. So I think we should learn the emergency one first. How about for inflammatory bowel disease and laryngeal obstruction? So to dilate it, right? So this is the injection we are talking about. Topically, you use for many things. Okay. In lepra reaction also they may use it. Okay, in certain types. Okay. People mainly you remember asthma anaphylaxis. Okay. There's something else called as hydrocortisone sodium succinate. That one I think they're using in some laryngeal obstruction. Laryngeal occlusion. To prevent it actually in angioedema. Then glucocorticoid replacement therapies if some patients are there. In mixed edema coma they are talking about it, people. Focus. Then what else? In thyroid dysfunction also. Did I already tell you about this glucocorticoid replacement therapy? Adrenal crisis management. There also they're talking about this. Did I already tell you about inflammatory bowel disease? There also you can use. Just few more, people. Don't worry so much. Okay, we'll just finish it off. Okay, just four more drugs are there. Posy flush. What do you use Posy flush for? Here. If you're getting bored, I'll use a different color for you. Wait, this one. Posy flush. Why do you think they wrote Posy flush here? This is some pre-filled syringe. Okay, some brand name looks like. So if IV catheter becomes blocked or something, you can remove also any medication that is left in that. If it is blocked or if there is any other medication left in that, you can use a Posy flush for it. Okay. Okay, next, just four more. Sodium bicarbonate, soda bicarb, I will use. Obviously, if there is somebody having a lot of acidity, I feel, right? Then you will give soda bicarb. So if they have chronic kidney disease, if there are some drug interactions which have caused some, I'm thinking, reduced pH. If there is some salicylate poisoning, that is acidity against salicylic acid, right? Then you can give this. If you want to alkalinize the urine, then you can give this, right? When will you want to alkalinize the urine? To remove some toxin again, I'm thinking. But it is not given for raised anion gap acidosis, like lactic acidosis. Like for that, you will not give. Okay, then what else? If somebody has ventricular tachycardia, monomorphic associated with QRS prolongation, that time also they can give sodium bicarbonate. So usually this is given for what? A metabolic acidosis. Any overdose of any poisoning, if it is causing acidosis, okay, they are considering this as a and one of the solutions to remove that acidosis. So you understood, right? Sodium bicarbonate to treat chronic kidney disease, to treat some drug interactions which are causing this acidosis, for salicylate poisoning, to alkalinize the urine, etc. Now let's move on. Just three more. Yes, dexamethasone. So again, a steroid here. For altitude sickness, for mountain sickness, that is right here. Altitude sickness, mountain sickness, for brain tumor, for gastrointestinal obstruction, for that is high altitude cerebral edema. That's what we told you. Then meningitis, pain management also you can use, for spinal cord compression also you can use. Okay, these are the things about dexa. Now last one, last two, come on. Phenytoin you will use for what? Though it is not the first line, phenytoin comes in the list for status epilepticus, right? Main thing about phenytoin is it causes a lot of drug interactions, so you should be very careful while using it. Okay, last one people, adenosine. Why will you give adenosine? Last one, see. So basically adenosine again to set right your heart rhythm, people. Okay, so that is what is the use of adenosine in emergency. Some kind of tachycardia actually. Supraventricular tachycardia and so many other types of tachycardia they're talking about, people. So people, now we'll do one thing. We're done with adenosine, right? That is for some tachycardia. Done. Now let's move on to the second drawer, people. Second drawer. We'll go very quick from here now. Don't worry. So cannulas, IV cannulas. Then what is this? Three-way. Then a pressure monitoring line. It's an extension. Looks like syringes. All types of syringes. Then needles. Why will you keep needles separately? I didn't understand. Okay, then needle comes separately than the syringe, is it? Alcohol swabs, okay. When did you use alcohol swab? Before puncturing for phlebotomy, is it? Then tourniquet, only one they have kept. Okay, micropore, that is to bandage and sticker, etc. Vein O line, nice name. Then IV set. Okay, IV set, you'll need the complete set. So cannula plus set, you'll have what comes in an IV set. Let's see. Just this wire looks like with that bubble trap. You know this one. You see this thing here. This is called as a bubble trap. They had asked me in the exam what it is in my Viva and finally in medicine, and I didn't know what it is. I know that drop by drop it keeps falling the drop, but it's called a bubble trap so that the bubbles won't go to the patient. Okay, so we are done with that. Then OT gauze. Okay, gauze, which we take from the tub all the time. Remember, with the forceps. What do you call? Holder, gauze holder. Then cotton swabs. Okay, then third drawer. We have reached the third drawer. Here you're keeping the laryngoscopes. Yeah, I remember this. Laryngoscope with all these blades, ET tube, endotracheal tube, tracheal intubation stylet, Magel forceps. What is Magel forceps? Yeah, that only we call it as sponge holder, etc. Right? What do you call it as? Ryle's tube. That is a nasogastric tube, right? Or can it be an? It's a gastric tube. Adult O2 mask. NRMB is what? Sorry, NRBM. You should know the full form. NRBM. Very important. Non-rebreathing mask or something. Wait. Let me show you that one. Go here. This one. Non-rebreather mask. Suddenly something happens to the voice quality, right? Oxygen extension tubing. Oropharyngeal airway. Those things which you keep in the mouth. Oropharyngeal. See, like this. Oropharyngeal airway. But these people, they will have gag reflex. So you should be sure in whom you are putting. Okay. Then. Suction catheter. Boogie. That is a tracheal tube. Boogie. Okay, that is so that you can do the intubation, right? Then suction tubing. The tubing for the suction. Here, suction catheter, suction tubing. Straight connector. What will you connect straightly? Straight connector. Connect it straight. Connect it. All that. Okay. Then. ET tie. Endotracheal tie. How does tie look? To secure the endotracheal tube. Wow. I would have just put that tape. What tape is that? That thing. Micropore. Okay. Then you have Durapore. This also sounds the same thing. Pencil torch. I said keep the torch on top only. Lox jelly also I told keep on top. But anyways, Lox jelly inside is also fine. Battery cell. Yeah, I think for putting for this all these torches. Tongue depressor wooden. Only one they kept. Sterile. Okay. I would have kept a lot of tongue depressors. Whoever comes, we check cold, cough, how are the tonsils, etc. Okay. Then sterile gloves. Yes, we keep. Only 3. Okay. ECG roll. Okay, so that you can refill the ECG machine. ECG leads. That we keep that with the ECG in the ECG trolley only. Okay, then moving on. Fourth drawer. What will you keep in the fourth drawer? Fourth drawer, according to this hospital from where I have taken these photos, normal saline, ringer lactate. So basically all the heavy bottles they've kept down. Okay. Then apart from this, what and all would you like to keep in your crash cart? We are almost done with our list. Okay. Apart from this, what do you think you would like to keep, people? Let's look at some other PDFs and check. Wait. I'll just go on mentioning some things here. Oxygen cylinder should be there in the side, it seems. Then handheld suction apparatus, they are saying. Then some IV stand. IV stand also should be there. But IV stand is next to the bedside of the patient, right? Okay, but if it is the patient has collapsed somewhere in the corridor or something, then they want a crash cart with IV stand, right? Then usually they are saying right side you keep surgical items and left side you keep medical items. But if you this right and left gets very confusing in medical knowledge, right? Because sometimes we meet in the right of ours or the right of the crash cart, or you know how it works in medicine. You always talk about right is this one because you are looking at the patient, correct? And left is this one because we are looking at the patient. However, in crash cart, if we start labeling this as right and this as left, that could become a little confusing, people. Then bottommost part of crash cart, they usually putting liquids. Okay, it's not cash cart, it is crash cart. Then you have two monthly, you have to monthly or every however often you think you will have to maintain this. Okay. Some people know they're also talking about some tablets. Okay, people like Atorva Start 10, aspirin, then metoprolol, so many names. I'm not just going to read all the names, but you can understand, right? So even after doing ECG and you suspect a myocardial infarction, you can keep the loading dose of the aspirin, clopidogrel, atorvastatin, etc. Those tablets also. So they're talking about keeping some life-saving tablets also in this crash cart. It depends on your hospital and the regulations, how they are. You can decide what to do. Okay. So in this video, you have looked at you have looked at what? Crash cart and the contents. Okay. As per one particular hospital from which I have taken the photo. Bye bye.